Is telemedicine the future? One doctor joins me now to tell me whether it is or not and what her experiences have been like. Dr. Achiamah Osei-Tutu joins me now.
Hi, how are you?
Tell me about telemedicine and your role in it.
Yeah, so I got interested in telemedicine as a senior resident in dermatology at SUNY Downstate. I'd always done work in Ghana, starting from college. I worked with HIV patients and, visited a prostitute camp, basically, and I wanted to find a way to go back. And obviously, as a dermatology resident, I wanted to find a way to use dermatology. And somebody came and gave a talk about teledermatology in use in Alaska. And I was like, this is an absolute perfect fit. And so created a proposal, got it approved, and went to Ghana and used the platform. And probably published one of the very few or first studies that show that you can use a phone to make a diagnosis and have very similar results as basically sitting in front of the doctor.
So how does it work? Like determine a problem or a condition,
okay.
And if
acne.
Okay.
My favorite problem because I suffer from it. So you have acne. For some reason, let's say you're a New Yorker, you don't have time to go to the dermatologist's office, or for some reason you don't have insurance. You basically become part of a platform. You pay a subscription fee, or you just pay to have the consultation. You take a picture of your skin, from basically 3 angles, front and sides. You put in information about your medical history, pregnancy, things like that. You transmit all of that information via a HIPAA-compliant platform, and then the doctor on the back end gets that information at their convenience.
So does it miss anything though? Are you able to diagnose kind of, or with sure?
No,
with
I mean
surety?
there have been teledermatology and telemedicine has been studied for more than 30 years, and
because
so,
skin is tactile.
Sure. And I mean, it's a tool, right? It's not good for everybody. And if we see something on the phone or on the camera or in video conference that we feel like you need to go see somebody in person, then we'll also mention that as well.
And what kind of impact has it had in Ghana and in other places that you're
so,
operational?
as far as Ghana is concerned, I only did a small pilot project, and if you know anything about international health, it's very difficult to continue things unless you actually have somebody on the ground.
Yeah.
But when we went, we had such great feedback. One of the things that the doctors said was that there are probably, I would say, 10 to 25 dermatologists in the country. And not only are there a few dermatologists, but they're also geographically located in the main cities. And so they don't talk to each other like we have here. Most of my colleagues, I can text them if I have a problem or a question. This brought him in direct contact with the dermatologist who has more information than him or who has more knowledge than him, and he found that very comforting. So not only can you help the patients and increase access, but you also have doctors talking to each other as well.
What do you think, in your experiences and your observations, is the one question a woman has to ask herself the most?
Good question. Well, I'll speak for myself. I think in my career there has been a lot of, can I do this? There've been a lot of obstacles, people telling you can't do certain things. Even going to Ghana, there were so many obstacles, and just asking yourself, can you do this?
What is the issue that you think faces women the most in your region?
In Ghana, or just?
Actually, let's say in Ghana.
In Ghana.
Yeah.
I think, access to care has been a big issue. And, just like for, people on the continent in general, bringing care to the people who actually need it.
And finally, what is the best advice you've ever received?
Keep God first. Keep God first. Yeah.
Great. Thank you so much, Doctor.
Thank you very much.